Hello everyone, I'm Dr. Akhila Bhandarkar, endocrinologist in K.S. Hegde Medical Academy, Mangalore, Karnataka. So today we'll see how to control that post-meal surge or postprandial surge. But before we go directly diving into the topic, I think we should know what is postprandial surge. So the first thing I'll be discussing is what is PP surge, or PP basically means postprandial or post-meal. So in non-diabetic, usually the blood sugars after food can go up to 140. And in diabetic patients, the blood sugars after a meal can go up to 180. So anything above this, 140 in non-diabetic and above 180 in diabetes is what we call it as postprandial surge or a post-meal surge. So now that we know what is called as surge, let's see the next thing is why is this postprandial surge bad? So what's the problem if postprandial blood sugars goes high? What's the problem? So multiple studies have been done and it is shown that even if the fasting blood sugars are okay, the postprandial blood spikes alone can be actually hazardous. So the studies done in this aspect is the Chicago Heart Association study, Rotterdam study, Paris prospective studies. So all these studies have shown that a postprandial blood sugar when it is high, despite when fasting blood sugars are okay, so they can actually cause damage to the blood vessel, leading to clot formation, leading to blockage of the blood vessels, and that can lead to stroke, heart attacks, and many such cardiovascular complications. So not just that, the elevation in cholesterol levels can also occur, and it can also cause a deterioration in the cognition, meaning the memory and everything. And apart from this, a national survey done in US has also shown that retinopathy can also occur even if the fasting blood sugars are okay and postprandial blood sugars are bad. So now that we know postprandial blood sugar elevation is not good, okay, so why does it go up? Okay, how does a postprandial blood surge occur? So let's see about this. And once we see how it occurs, we'll also see how to control that. Okay. So, the postprandial blood sugar basically means that once you have eaten a food, the blood sugars go high. So normally the food, whatever comes into our gut and then to the blood, so that has to be, counteracted or nullified by insulin release. So the problem in diabetes is the same. That's the insulin secretion is defective. So now this is not a problem only with type 1 diabetes, but also in type 2 diabetes. So it's seen even in type 2 diabetes patients quite early on itself, the phases of insulin release, particularly the phase 1 and then phase 2. So the insulin release is affected, and that's why these people may have fasting blood sugars normal initially. That's without the food, the fresh food entering, the glucose particles entering. But once the load of glucose comes into the blood, the body is not able to take it. Insulin is not enough to neutralize it, and that's why the patients face a postprandial surge. Okay, so now that we know how postprandial surge occurs, let's see how to defeat this postprandial surge. So, some of the tips and tricks for this is, first most important is low carbohydrate food. So as we discuss about the low carbohydrate food, we'll also see about something called GI or glycemic index and GL or glycemic load. So the food what we most of us eat in India is usually carbohydrate rich food. So carbohydrates are not bad. So definitely they are one of the essential macronutrients. But the problem is when it becomes excess, specifically in those with the diabetes, then we'll have to face multiple consequences due to a carb-rich diet. So what we advise is to have a low carbohydrate food. So as we are talking about carbohydrate, so the something called as glycemic index, as I had initially mentioned, that comes here. So glycemic index, what is glycemic index? A particular food when consumed can lead to increase in the blood glucose level. So, which food, when consumed, leads to how much of blood glucose spike? Now, that's what is called as glycemic index. Okay, so for example, sugar. So, when refined sugar is consumed, so that sugar will lead to a particular amount of elevation of blood glucose, and we take the glycemic index as 100 for sugar. Okay, so those foods, when the glycemic index is less than 55, is what is considered as low glycemic index foods. So we should go to such foods which have low glycemic index foods. I'll come to it in a short while. So the second part of it is what we call it as glycemic load. So how much food when consumed leads to how much elevation? So that is what we call it as a glycemic load. Again, we have to go to such foods which have a low glycemic load, particularly less than 10 is what we say. So listing out the foods which have low glycemic index and low glycemic load is the pulses, okay, specifically the dals, okay, like tur dal, the legumes, lentils, and then particularly some of the fruits we have like papaya, guava, okay, oranges, mosambi, and watermelon. So these are all actually coming under the low glycemic index, glycemic load foods. And not just these, nuts also, particularly almonds and peanuts, when consumed in a limited amount, they're definitely good foods, and they are advised in diabetic patients as well. Yeah, so apart from this, the whole grains, oats, barley, quinoa, so all these can be used to prepare our usual household foods. So say we are having idli, then we can make the dough out of these foods, and then make it in the form of idli or dosa, use the base as oats or ragi or millets or whole grains, and then using that dough you make particular food items whichever you like it. So that's one way of actually reducing our postprandial surge. That's using the low carbohydrate or low glycemic index in low glycemic diet. So the second point is split your meals. Okay, so split your meals means what? So let's say that I'm in a habit of having 3 idlis every day. So and I want that 3 idli at any cost before having lunch. So I'm hungry or not. So what I can do is I can split the same amount of food in two parts, say. Like if I'm eating 3 idlis, I'll have two in the morning in the breakfast time, and then another idli in between the breakfast and lunch as a mid-meal, like, a snack. So this way, if I split the same amount of diet, the postprandial surge will definitely come down because the glucose load I'm giving is less. So if you're having poha, maybe 2/3 you can have in the morning and 1/3 you can have as a mid-meal snack. So the same amount of food has to be split. I'm not advising to have additional meal, but just to split the same amount of food in parts and consume it so as to reduce the postprandial surge. So let's go to the third point, and that is to have fiber-rich foods. So fiber-rich foods basically mean vegetables and fruits rich in fibers. Okay, so they have to be consumed either before your food, before your meal, or along with your routine meal. So that is one of a very smart technique to actually bring down the postprandial surge. And then the fourth one will be to avoid sugary foods, avoid sugary beverages. Like say you like having carbonated juices, so avoid it. And then reduction of stress can also help. And then increase the water consumption, promote exercise. Okay, so these are some of the techniques you can incorporate in your usual lifestyle. And then the last one, so if you are diabetic, then do not miss your medication. That will definitely cause a surge if you miss your medication. So along with whatever tips and tricks we have told now, you should not miss your medicine, that's for sure. Okay, so let's hope today's video helped you. So signing off. Take care.